Hello, please subscribe and like for our channel. Thanks very much.
Now, in the case number 90, you have a day case surgery. A 56-year-old man has been referred to a surgical outpatient department with a right-sided inguinal hernia. So you have a patient that presents with right-sided inguinal hernia. He has requested a day surgical procedure. The patient has type 2 diabetes and hypertension. He has no history of myocardial infarction or angina. He lives in a house with 10 stairs which he can climb easily without shortness of breath. He take metformin 500 milligram for his diabetes and atenolol 50 milligram daily for his hypertension. He is non-smoker and drinks fewer than 12 units of alcohol per week. He lives with his wife who is fit and independent. Examination: his blood pressure is 130/8 meters of mercury. The pulse is normal. His body mass index is slightly overweight. He's overweight. Random blood sugar is 6 millimoles per liter. The chest is clear. Now the question is, which factors are important for the patient to be considered for a day surgery? In order for you to consider a surgery, these are anesthetic questions. Ezekiel, what are the things that you have to evaluate? You must evaluate the identification of the patient. Ezekiel, with the risk factors of the patient. Like, what is the age of the patient? You must evaluate the patient, the age. Ezekiel, if the patient is old age or is very short, small age, the patient cannot withstand the surgery. Two, you must evaluate the risk factors of the patient. Ezekiel, so what factors are important in a daycare? So evaluate the age, that's one factor. Second factor, you evaluate for the past medical history. If the patient is hypertensive, if the patient is diabetic, you evaluate for the surgical history. If they have been operated before and they had an anesthetic complication or an allergy to an anesthetic, is it clear? You have to evaluate for social history. The patient is smoking, the patient is taking alcohol and all that. Is it clear? So those are the different anesthetic things that you ask to the patient. What is the patient ASA classification? In this case, you have a patient that has a controlled diabetes and controlled hypertension without any complication of diabetes and hypertension. So it's on the ASA 2 classification. ASA 1, you have a patient that is normal without any disease. ASA 2, you have a patient that has diseases but is not symptomatic. The disease is well controlled. ASA 3, you have a patient that has disease which is poorly control. Is it clear? The disease which is poorly controlled, but the patient do not have complications of that disease. Now, ASA 4 is a patient that has a disease that is poorly controlled. Is it clear? Disease that is poorly controlled means that the patient is not taking medication and the patient is having complication of the poorly controlled chronic disease. Is it clear? That's ASA 4. ASA 5 now, you have a patient that has is moribund. Is it clear? It's already dying. Is it clear? ASA 5 is when a patient is moribund, is already dying, and then ASA 6 is when there is a brainstem death. Is it clear? So why are the patient's social circumstances important? In this case, the patient's circumstances is important because the patient wants to go immediately when you're operating a patient. You should not just leave the patient on himself like that, because normally after an operation, a patient has to do 3 to 5 days in the hospital in order to prevent the immediate complication, the early complications of the surgery. Is it clear? But now, in this case, the patient wants to do an outpatient surgery, meaning that he comes into the hospital and then he goes directly in the evening. So you must know the social circumstance in this patient. You must know the social circumstances in this patient in order to evaluate if there is the possibility for post-operative complication to occur, and how the patient is going to be alert with those post-operative complications. So you have to know if the patient is living with another person, like in the case of the stairs. Climbing the stairs is also a very poor attitude for you to after a surgery. After a surgery, you're not supposed to exert the abdominal muscle because healing process is going to be impaired. Is it clear? So that's why the social circumstances are important. Now, the next question is, what will you advise about the metformin prior to surgery? Generally, metformin should not be taken 1 day prior to surgery because it results to lactic acidosis. Is it clear? So it's better to take insulin immediately prior to surgery, during surgery, and immediately after surgery for a best control of the diabetes mellitus. So those are the different things that you have to put into consideration. So from here, we are finished with the different tutorial. I'll say thanks for your kind attention. Please don't forget to like and subscribe for our channel. Thanks very much.
Hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429, and please don't forget to like and subscribe for our two channels, Science Video Makers and SchrDbb. Let me say the number again: 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year, the workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook. All this we have on the no contact 652-659429. Thanks very much.